Meanwhile, National Eating Disorder Awareness Week is this week, and today we're helping you see the warning signs. If your loved one or you are suffering from an eating disorder, it's very important to get help as soon as possible. We're going to help you do that today. Joanna Jones is here to tell us more. Good morning to you.
Good morning. Thank you so much for having us.
Thanks so much for coming. You know, you and I were talking before this segment. This is such an important topic.
Yes.
Unfortunately, eating disorders is something that we have not seen decline. We've actually seen them rise in young women. Tell me why you think that is.
I believe that the ongoing pressure on women to look beautiful and look thin, combined with a lot of pressure from schools and from life alone, does not let the numbers down. So, the latest research shows that 1 in 200 women exhibit some signs of anorexia, and 2 in 100 have bulimia.
Okay, so we're talking specifically about anorexia and bulimia. Anorexia is when you simply just do not eat enough. You basically starve yourself.
Yes.
Bulimia, of course, is when you eat a lot and then throw it up afterwards.
Purge in one way or another. But then we also have clients who overeat, and that's the new form of eating disorders.
So we talked about the societal pressures and why we're seeing these eating disorders go up. I think a lot of times people don't notice the signs, and that's why you're here today. We're here to tell people, if you or a loved one suffers from an eating disorder, how to look for signs. It could be a friend, it could be your daughter, it could be your mother. So many people suffer from this, so we're really helping you out this morning. Number one, noticeable and unexplainable weight loss. This is obviously a big indicator.
Yes, it can be a weight loss or can be a weight gain. But weight fluctuations are definitely a warning sign to all eating disorders.
Okay, also a tendency for skipping meals or refusing to eat in front of others. That's a big one. Let's say you go out to dinner with someone and they simply just often do not eat with you. That's a big warning sign.
Right, and interestingly enough, they will order their meal and they will just push food around the plate. So that's a warning sign. Or social isolation when it comes to meal times.
Oh, okay. So actually eating maybe in their room by themselves?
Yes.
Okay. A habit of eating extremely small portions. It's one thing to go on a diet and really watch what you eat and eat healthy, but it's another thing to restrict your calorie count so much that you're just not eating enough.
That's absolutely correct. So, a typical meal for a person who is highly anorexic would consist of maybe a few crackers, maybe one carrot, and they strongly believe that this is a full, well-balanced meal.
Okay, someone with an eating disorder can often have an obsession with the calorie information and fat content of the foods that they're eating.
And numbers in general. They will count ounces, they will count calories, and be extremely proficient at that.
I think a lot of times we hear that people with eating disorders, it's a need to be in control. Do you see that a lot with the patients you see?
That's absolutely correct. So their need for control is often stemmed from their childhood or some trauma in their life. So that's their bodies is what they can control.
So that's what I was going to say. Do you often see in the patients that come to you, is there something that happened in their life that sort of triggered an eating disorder? Often you don't just wake up and decide you're going to have an eating disorder. It's something that happens beforehand.
Right. So research shows that between 80 and 90% of patients who later on develop eating disorders will have some trauma earlier in life.
Okay, so some sort of trauma. People with eating disorders have a preoccupation with their body size, shape, and weight, both with their self and with others. They'll notice others' body shapes and almost be obsessed with it.
Yes, and also, when you take them, for instance, to shop for clothing, you will notice how uncomfortable they are trying to select the correct sizes.
Okay, they'll also have persistent complaints about being fat, even when they are noticeably thin.
Right. So, so it goes back to the distorted self-image and the image of others.
Okay, there's a few more on here. Unfortunately, we can't get to all of them, but what we really want to do is tell people how they can get help. So how can we do that?
Yes, so Montecatini Eating Disorder Center is a part of the CRC large company, the largest company of behavioral health in the nation. We are right up the street in Carlsbad. We are the only program in the San Diego area that has all 3 levels of of eating disorder treatment from residential to outpatient. So we can actually cover the entire spectrum and provide a great seamless care for the patients.
It's really important to educate yourself, for your loved ones and for yourself, and know the signs of eating disorders.
That's
to see
correct.
if you or someone you love is suffering, and then get them help right away.
Yes.
Before it's too late. It can often be a very deadly disease.
It is, and it actually has the highest mortality out of all mental diseases.
Mm-hmm. Okay, well, thank you so much for coming today.
Thank you for having us.
Such an important topic, and go and find them if you or someone you know suffers from an eating disorder. Very important to get help right